Hello, my name is Liz Beverly. I'm a professor at the Ohio University Heritage College of Osteopathic Medicine, and I am co-director of the Ohio University Diabetes Institute and principal investigator of the Southeastern Ohio Quality Improvement Hub. Today, we are going to be talking about social drivers of health. We will go over some information about our region, as well as review some common screening tools. But first, I'd like to acknowledge that the Southeastern Ohio Quality Improvement Hub is funded by the Ohio Department of Medicaid, and it's administered by the Ohio Colleges of Medicine Government Resource Center. Importantly, the information I'm about to share represents the information that I have found, and it represents my views rather than the views of the state of Ohio or federal Medicaid. So what are social drivers of health? Sometimes you may have heard of them as social determinants of health. Well, these are the circumstances in which people are born, grow up, live, learn, work, and age. They are categorized into 5 different areas. These areas are education access and quality, healthcare access and quality, economic stability, neighborhood and built environment, and social and community context. When we think about the health and well-being of an individual, research has shown that we are actually able to quantify how much of it is influenced by different factors. We know that the health and well-being of an individual is about 30% genetic. In terms of healthcare and access and quality, about 10% of that influences the health and well-being of an individual. And then if you look at the social and environmental factors and individual health behaviors, that takes a whopping 60% of influencing the health and well-being of an overall individual. And that is why it's so important that we focus on the social drivers of health or the social determinants of health. And that's why it's so important that we measure these things and document them in the electronic health record. So a recent review that was published in Diabetes Care by Felicia Hill Briggs reviews the social drivers of health and type 2 diabetes. So I'm going to present some of the information from that review and go over what the findings in the research community say. So we know with education access and quality that a lower educational attainment is associated with an increased risk of type 2 diabetes. We also know that lower rates of high school graduation are associated with an increased risk of type 2 diabetes. And the increased incidence of type 2 diabetes is associated with less than a high school education. And then when thinking about literacy and numeracy, lower literacy is associated with having a higher hemoglobin A1C. When thinking about healthcare access and quality, those who are uninsured have a 60% fewer medical visits. They tend to be prescribed 52% fewer medications, and they have 168% more emergency department visits. We know that diabetes is one of the most expensive chronic health conditions to manage, and healthcare costs for adults with diabetes are 2.3 times more expensive than people who do not have diabetes. And research shows that insurance and having insurance is the strongest predictor for an individual achieving their quality measures. When thinking about economic stability, the prevalence of diabetes is associated with income overall. So individuals who are living below the federal poverty line are twice as likely to be diagnosed with type 2 diabetes. And then those who have a lower income, research has shown that they have a higher hemoglobin A1C. When thinking about neighborhood and built environment, some research has shown that 37% of people who have diabetes report housing instability, and this is something that we see very commonly in our region. Walkability of neighborhoods and access to green space. If you have poor walkability and decreased access to green space, that's associated with higher rates of type 2 diabetes, whereas if you have higher rates of walkability and more access to green space, that's associated with decreased risk of type 2 diabetes. Exposure to toxic chemicals in the environment is also associated with increased risk for type 2 diabetes. And then looking at the food environment, where increased food access, availability, and affordability is associated with decreased risk of type 2 diabetes, whereas the opposite, where you have less access to food, less access and availability, and then decreased affordability is associated with an increased risk for type 2 diabetes. And then in the last category with social and community context, it's really important to look at social cohesion. So whether or not someone feels that they are connected to people that they're living around, and social cohesion if someone feels that they are connected to the people that they're living around. That is associated with a 22% decrease in the risk of developing type 2 diabetes. Similarly, people who feel social support, we know that social support is associated with lower A1Cs, and it's also associated with increased quality of life. And some recent literature that has come out that has looked specifically at race and racism, this literature has shown that exposure to racism, especially exposure on a daily basis, is associated with an increased risk of type 2 diabetes. So you can see here by looking at research that has been done specifically on social drivers of health with type 2 diabetes, you can see the impact that it has not only on the risk of developing diabetes, the prevalence of diabetes, but also on specific diabetes outcomes. Now, in our region, we are well aware that people in our region experience high rates of social drivers of health. For example, in terms of access to health care, Southeastern Ohio has 30% fewer primary care physicians, 41% fewer mental health providers, 65% fewer specialty physicians, and 33% fewer dentists compared to the rest of the state. We also know that 17% of the population in Southeastern Ohio lives below the federal poverty line, as compared to 13% of the United States and 14% of the rest of Ohio. We also don't have a public transportation system, and this has to do with the fact that we do not have a system where we have paved roads and we're easily affected by extreme weather conditions. And this limits the ability to have a public transportation system because it is such a rural area. But it also limits the ability for people to access healthcare because they don't have access to a transportation system. And along those lines, because it is such a rural area with unpaved roads and very narrow roads, we are at the foothills of the Appalachian Mountains, so we see the forests and the rough terrain of Southeastern Ohio. This contributes to the ruralness of our region, but it can also contribute to the sense of isolation in our region. And that is emphasized on the social context and community, because it's very important that we focus on not only social isolation and loneliness, but taking into consideration the ruralness and the rurality of our region and the impact that it has on someone feeling socially connected to the community. So what is it that you can do? Well, many of you may already be using screening tools for social drivers of health. Here are 3 very well used screening tools. So there's the one that's endorsed by the Centers for Medicare and Medicaid Services, and this is the Accountable Health Communities Health-Related Social Needs Screening Tool. Overall, there are about 10 questions in this one, and it includes supplemental questions. There's the American Academy of Family Physicians Social Needs Screening Tool, and that has 11 questions. And then there's the National Association of Community Health Centers Protocol for Responding to and Assessing Patients' Assets, Risks, and Experiences tool. And this is referred to as the Prepare tool. And that has 17 core questions and 4 supplemental questions. And I'm going to go over each of these very briefly and talk about what's measured, and then we'll get into recommendations. So if you're looking at the Accountable Health Communities Health-Related Social Needs Screening Tool, this is available for free online that can be used. The questions at the beginning, they have 2 questions on living situation, there are 2 questions on food, there's a question on utilities, and 4 questions on safety. Now, there are numerous supplemental questions that can be used. These address financial strain, unemployment, family community support, education, physical activity, substance abuse, mental health, and disability. And those supplemental questions can be used if you're interested in using them. You can see here I've just included a screenshot of what the questionnaire would look like. This is what it looks like. It can be used if you download the tool, but it could also be something that's integrated into Epic or other electronic health records. Looking at the American Academy of Family Physicians, this is their social needs screening tool. You can see here that there are 2 questions on housing, 2 questions on food, 1 question on transportation, a question on utilities. There are 4 questions on safety and 1 question on assistance with the social needs. And that is them at the end asking if they would like help to address some of these social needs. And then the last questionnaire tool that I'd like to talk about is the Prepare tool. And so with this, you have 5 questions on personal characteristics at the beginning. There are 3 questions about housing, 6 questions about money and resources, and 2 questions on social and emotional health. There are additional supplemental questions. There's a question that looks at whether or not anyone has spent any time in jail, or prison, or a detention center in the past year. There's a question about someone's refugee status, and there are 2 additional questions about safety. So what are the recommendations? Well, recommendations are that an individual should be screened at least once every 12 months for social needs. The screening can occur in various healthcare settings. It doesn't have to occur at a primary care visit. Of course, it is strongly encouraged to be at a primary care visit, but this can all occur at any medical appointment. Screening can occur before, during, or after a clinical visit. It can be administered in multiple ways. It can be self-administered. It could be administered by proxy, by having a caregiver complete it, or you can have someone who's a medical staff member administer the screening and then complete it on behalf of the individual. And very importantly, the screening tools that I have mentioned can be integrated into Epic and MyChart so that individuals complete it ahead of time in their MyChart, but also having them as a template in Epic can make it so that's readily accessible for healthcare providers to see the information and to access it. So in conclusion, we know that social drivers of health have a huge impact on someone's overall health and well-being, so it's critical that we assess this. So screening for social drivers of health is critical because if you don't know what's wrong, you won't be able to help that individual, and we know that social needs play a big role in someone's health. It's also important that these electronic health records, such as Epic, have templates with many of these screeners, or certain other questions that you could use for screening for social needs. So what's important is to make a plan and to have this be a part of the clinical workflow. So coming up with this process, developing perhaps a PDSA around it for how to integrate this is important. For example, you could have a rooming process that when a medical assistant brings a patient into their room, that is when they complete the social needs screening tool. There are many ways that you can integrate it into clinical workflow. And then lastly, and this is one of the most important points, that screening is not enough. Just screening for social needs is not completing the process. If you're going to identify social needs, there has to be a way to then provide patients resources. So I've included 2 websites. There's the findhelp.org. Formerly, this was known as Aunt Bertha. And then there's the AFP Neighborhood Navigator. And this, again, is something that is tailored to your region where you enter your zip code and it tells you all of the available resources to help address specific social needs in your region. So these are 2 very helpful tools, and we also have a handout for you that is available that also includes additional tools that you may be able to use. So thank you very much for your time, and I hope that this was helpful.